breath in, all the way out. Good. Ooh, right there.
When you press into them, they're sore, but when you don't touch them, they're fine.
You should turn your head as far as you can to the left for me, and then drop into my hand as if it's a pillow, please. Good.
Love that one.
That one was very specific. There might be more lower down because we only got the very top with that one. Again, drop for me. Yeah. Paige, thanks for coming in today. Good to see you. It's been a while.
Yeah.
What's going on?
So I have chronically tight traps. So because I'm going on a plane for what is it, like a 10-hour flight to Germany or something on Saturday, I was like, I don't really want to sit there and just gain more soreness and then get to the hotel and tell my parents I hurt.
You are? Yeah.
Because that will probably decrease the quality of the trip.
Just a lot.
Yeah. So I've been to chiro, physio, massage, and all that stuff before.
Been to all of them. Okay.
It kind of started off with a shoulder injury, rotator cuff inflammation / bicep tendon inflammation. Kind of were the two things that I got from the chiro / athletic therapist at uni.
Like that's what they told you.
Yeah.
They didn't give it to you.
No,
okay.
No.
Just clarify.
Okay. If they gave it to me, I'd be pretty mad
I
because
would expect
it screwed my swim career a little bit.
Yeah.
But basically, I've tried all the things. I know you're from Primal, seen you around, know you've worked out here before, and Anna gave me the name saying you do a bit of massage and chiro and stuff, and I was like, perfect.
Paige is in. Awesome.
Paige is in.
All right. So you got that right flare up right now in the trap and the neck. When did that flare up start?
This flare up started, I'd say, kind of a week ago. It wasn't as bad. It was during a swim practice. When I turn my head, I'm mostly a one-side breather in freestyle, which isn't great.
Hey,
I know.
So was I.
Yeah, it only started in uni, so I've been trying to break it. So I've been trying to do the 3-3 pattern, but it's honestly the left side that if I turn to breathe to the left sometimes, there's like shooting pain that goes up the left side, and it's like I'm transferred to a different dimension for a second. And then when I change back to like breathing forward to my neck.
You're primarily a right side?
Yeah, mostly right side breathing.
So much in common.
Yeah. But basically just the entire trap, and then I don't even know what the muscle back here is.
It looks like she's pointing to left scap. Y'all will be very familiar with it on the channel. Okay.
Yeah, so it just gets really, really sore, and then it starts to pain my shoulder.
So it's very much on the right side right now, or the left currently?
It's very much on the right now.
Okay, very much right. We'll address both sides.
Yeah.
No problem. We're two-sided creatures. And you leave Saturday. We're shooting this on a Thursday, so no pressure or anything is what I'm hearing. Now you've seen chiro before, like you mentioned, so you respond well to the massage and the adjusting of the cracking, and that's kind of your preferred method of treatment.
Yep.
Awesome. That saves me what we're going to do later, even though we need to obviously examine her still. Anything else that you want to share about? Oh, any symptoms into the arm at all, or is it staying pretty?
It stays pretty much up here. I mean, my joints are just kind of screwed up in general. I have over-flexible joints, hence why I've had so many ankle sprains and shit in the past.
I read that in the intake as well.
Yeah, so there's just like a little soreness along the elbow, but...
But nothing like shooting?
No, nothing shooting,
no,
just
no
like...
nervy stuff?
No,
okay,
no nerve at all.
Good. All right, so today what we're going to do is we're going to do our darndest to get that trap under control, that left scap under control. We're going to do a physical exam, then get into treatment. Sound good? Perfect.
Amazing.
I'll get you to start by bringing your chin down to your chest for me, okay? Any discomfort in the right area or the left with that?
Soreness all along, like the neck trap there, and then just a little bit of just like tightness along the left side.
Along the left side. Okay, now if I do something mean and push that down further, better, worse, or the same?
A little bit worse on the right.
Okay, come
same
back.
On the left.
Okay, come back up, look up to the ceiling for me. How about now?
Neck cracked there, but just, I'd say tight, no pain, or a little bit of stiffness or soreness as I keep my head up.
Okay, now if I again do the same thing, better, worse, same?
Same.
Same? Okay. Rotate as far as you can to the right for me. We can get to about 80 degrees, pretty good. Now go as far as you can to the left. We can get to about 75. It's a little bit decreased, but not by much. I'll get you to bring the right ear down to the right shoulder. We're getting to 45 and left to left. We're getting to 45. So you're struggling a little bit when your head was shaking a bit when you turned to the left there.
Yeah.
Don't know if you noticed that. Was that aggravating the complaint? Or?
Just tight and sore. Nothing like aggravating or shooting.
Okay. Get you to bring both arms up for me. Keep them there. Don't let me move them, okay? Good. Good. Arms forward. Curl the wrists backward. Keep it there. Good. Good. Turn over. Curl the wrists inward. Don't know why I'm not holding the hammer yet. Good. Good.
Preemptive.
Fingers out. Yeah. It's because I know what comes after this. Curled. Good. Good. This is a neuro screening, by the way. I'm not expecting anything to be wrong, but
I was going to say, I've never had the neuro screening
cross the T
before.
and dot the I's, right? Squeeze my fingers. Awesome. Okay. Turn over. Good. Good. Drop that arm. There we go. Good.
I know the drill.
She's learning. She's had reflexes done before. Drop, drop. Drop the arm when you hold. You're not. That's not hell. That's not letting me hold it.
Oh, sorry.
There you go. You got it.
Yeah. I was
There we go.
going for the bottom
That's
hang.
okay. Good. Good. More. Normal upper limb narrow. Not that we'd expect anything else in this case. So, good. Now, we're going to start low and work our way up to the known aggravated area because it's good form to be holistic. Remember, anytime we have an issue with one location, very common that we get compensation above, so up at the top, and below, in this case, the upper back. So, be thorough, guys. Are you left or right-handed?
Right-handed.
Right-handed, okay. So most of the discomfort is all kind of in this region.
Yeah,
right?
and then towards the scap.
Towards the scap, like even further out.
Yeah.
Okay, yeah. So...
If you can feel that big knot right there.
A bit of a 50-50 here. Very much left scap involvement. That is where it connects, inserts. It does connect to this location here and pulls the scapula upward. But if you're getting, are you getting discomfort underneath the scap almost as well, wrapping around to the front a little bit, or no?
I wouldn't say so, no.
Okay.
If anything, it goes to like the distal end of the scap. Is that the right word?
Distal would probably be down
Yeah.
here. Okay.
If anything, it goes down there rather than forward.
So potentially could have some rib involvement as well. Remember, holistic things. Very rare is it just one thing is wrong. We could have one issue, but that's going to affect the things nearby. So, working through there. That left side feels really tight as well.
It might. Honestly, they're both really tight all the time. It's
Okay.
normally I just have one side that's in pain and the other is just tight.
Being a competitive swimmer sucks. I don't know why anybody would swim. It's a terrible sport.
We are just insane creatures.
I know, aren't we? Okay. All right. I'll get you to flip onto your back for me, please. That left side, too, actually feels even tighter than the right, but let's work our way down. So what are you looking forward to the most in Germany?
I've been to Berlin before,
Mhm.
just for like a day or so,
Mhm.
so I'm excited to see it.
Wait, you went to Berlin? Oh, you were in Europe and you just toured through.
Yeah.
Okay, I was like, that's kind of a waste of a flight.
Oh god, yeah, no, that would be dumb. That'd
Yeah.
be really dumb.
Mhm.
I guess I'm just excited to have like a different change of scenery kind of thing. Plus, it's snowy over there right now, so.
Yeah, here it's going to be 9 degrees tomorrow, December the 15th? That makes
What
no
the
sense
hell?
in Canada. Global warming is real, guys. Oh, sorry, did my channel just go woke? I don't know. See ya, subscribers. Yeah, so I am definitely feeling more tightness on the left side than I am the right.
Okay.
Yeah, so we're gonna
Maybe it's just pain compensation.
we're
on the
gonna
one
hit
side?
it all today. We're gonna hit it all today to make sure that we get all of this out, and then I'll see you whenever you finish your next swim practice. Yeah. All right. So. Turn your head as far as you can to the left for me, and then drop into my hand as if it's a pillow, please. Good.
Love that one.
That one was very specific. There might be more lower down because we only got the very top of that one, which granted is what we were going for, but usually you can get a few more. Again, drop for me. Yeah. Good. Okay. I'm going to move the mic over to the other side now. right there.
When you press into them, they're sore,
Yeah.
but when you don't touch them, they're fine.
You see, the issue is that you're supposed to not be this tender when you're touched there. Granted, I am going in with intent, but it's like the patients who say, hey, I'm fine if you don't touch me. It's like, all right. Turn to the right as far as you can. Good. Drop into my hand. Pretend it's a pillow. Nice. Okay. Take 2. Okay, hidden. Alright. We'll get you face down. Paige was low-key just calling me out for talking to myself in between takes. And I feel the want to share a story with both her and you guys. One time when I was in school, we were doing a practical examination because we have to practice these things on each other. And I was there with my partner. I just finished my exam. And the instructor at the time says, Adam, that was very good. You're going to get a high 90. Did everything right, but I'm going to give you a piece of advice that's really going to help you out in practice. And I'm like, okay, well, what's that, Doc? And he says, stop making sound effects. And, I was kind of shocked because I didn't realize I was making sound effects, but I look at my partner and she's like, yes, you were making race car sound effects as you were walking around me. And you know what? I think that I'm great with kids. I really, really do.
Specialty for you. Pediatric chiropractic.
Pediatrics chiro, right? But yeah, anyway, so fun story of me talking to myself reminds me of that. But anyways, let's loosen up some of these paraspinals before we go and try to adjust them. Okay. Take a breath in, all the way out. Good. All right, so over here now. You're going to turn your head as we do this one, okay? Breath in, all the way out. Ooh. Stubborn. In, all the way out. And one more. I'm just going to move the mic for this. And I'm also going to turn it off. There we go. Let's see if I can. Okay, in, all the way out. You've done and tightened this up real good.
It's my specialty, what can I say?
It's okay. Where hands fail, tools succeed. So, one more, breath in, all the way out. There we go. One more hidden one up there. Nice. Okay, we'll get you on your back, please. So, Paige here is an avid swimmer. All right, she got farther than I ever did in her career. And I'm going to let her kind of talk about what drew her into it and why she continues to suffer through that. I don't know any swimmers that actually like to swim. That's the thing, right?
Literally at all my practices, we're like, why are we paying for this to be tortured?
Yeah.
So I basically started swim lessons because my parents are like, let's not have our kid drown.
Solid rationale.
Yep. So I started with the town of Oakville, went through their lessons, went through them really fast. I was 7 or 8 years old, going to level 6, but they wouldn't pass me because I couldn't lift up the 12-year-old kid who was in the same group as me.
Nice. Yeah.
So we went to a different kind of swim school. I moved up the levels because it was Red Cross versus Life Saving, so they didn't have that stupid requirement. And so I passed all the levels. I was 8 years old. And the lady who owned the swim school was like, to my parents, have you ever heard of competitive swimming? There's a Oakville Aquatics competitive swimming program. Mm-hmm. And so they took me to a tryout. They put me into a Oak 2, which was the development group for the
that
under
feeds
10s.
Into Oak.
Yeah.
Mm-hmm.
So I was in that group for a year, and then I moved up into the more competitive programs. In my first year, I made provincials, and then started my way up into the groups. As I moved up, it was harder as a kid because I was young with all these older kids. Mm-hmm. Played a little bit of mind games on me. I wasn't happy for a long time. moved into a slower group because I obviously got slower.
Mm-hmm.
Got with people more my own age and started enjoying it again.
Good.
Got back to a point where I was constantly making provincials, moving up into like Easterns, kind of national time zones kind of thing.
Mm-hmm.
And then we graduated high school.
Oh, no.
I wasn't exactly sure if I wanted to go into university swimming or not.
Yeah.
It was a very much, okay, I got accepted to Waterloo. Didn't email the coach until I had accepted, being like, maybe we'll try it out for first year.
Mm-hmm.
So the coach was like, come to tryouts, blah, blah, blah. Get to tryouts in the fall. That coach left. He went to the Bahamas. It was like, bye, Jeff.
See you, Jeff. Hardly knew you.
Yeah. Communicated with you twice on email. Thanks. He's doing great in the Bahamas.
That's
I
good.
think he's over in like Abu Dhabi or something now.
He's living
living life.
Yeah. Mm-hmm.
I'm jealous. He's traveling.
Well, so are you, but not to the Bahamas. You're
No.
going somewhere cold because you're silly.
Yes,
So,
I know.
Yeah. As long as you acknowledge that, there's room for improvement.
I know, I'm dumb.
I wouldn't go that far. I don't outright insult my patients on camera.
I mean, I call myself a dumbass all the time. It's fine.
We got so much in common.
So when I got to university, I had a really good first year.
Good.
I was enjoying myself. I was getting super fast. I was enjoying myself. We get to second year. Start off second year strong, and then I have a co-op term in Toronto. I'm training with U of T, which was a great experience. We get to OUAs, which was like the provincials or whatever. Right before my first finals race, I do whatever I do to my shoulder.
Right, you bugged your shoulder, right?
Yeah, so I swim that race, hit a best time with a busted ass shoulder.
Phenomenal.
Yep,
Pure
last
power
best time
will.
of my career, but
Yeah.
you know. But then I didn't swim the rest of the meet because I could barely move my shoulder.
Lovely. Yeah, so that's probably one of the worst things you can do right after you injure yourself is go and compete.
I mean, it was literally 30 seconds before I dove in the water.
But I understand the pressures associated in that moment. So
Yeah.
the good news is that it's not permanently damaged, I don't think.
No, but it severely limited, I'd say, my training over the remaining 3 years that I was at university.
Exactly, right.
And it impacted mental health and all that stuff,
I'm
too.
sorry.
So I was mostly just kicking practices. I made it through the entire time, but by the end of it, it was like, I'm going through the motions. I wasn't really enjoying myself. So after I graduated, I didn't swim for a solid, like, year.
Well, it probably brought back all those memories, too, right? Like, the kind of what you lost as well. But,
Exactly. I'm very bitter towards my shoulder.
hey, which shoulder was it?
This one,
Bad
right shoulder.
Bad shoulder.
Bad shoulder.
Yeah. Mhm.
But at the beginning of this summer, I was like, I want to get back into swimming because I had started going to lane swims and stuff again, and I was enjoying it, but I hated lane swims because
same.
they are god awful.
Yep. People don't understand the fast lane is slow, and it's like, all right.
Yeah,
well,
it's a pain.
I tried. Mm-hmm.
So I knew there was an Oakville Masters team, so I emailed the team and was like, I'm a former competitive swimmer, haven't been in the water in a while, but wondering if you had any space.
Mm-hmm.
So I started swimming once a week over the summer for 6 weeks. Was great. They ended up having more space for me in
Good.
the fall/winter. So I'm now swimming 3 times a week, and I'm back to enjoying it.
Well-
except for shoulder pain.
I mean, the shoulder pain is something that we can also take a look at over time if you're
Oh, for-
interested. Although I'm granted, you've probably seen all of the practitioners for it, right?
I've tried.
You've tried, yeah.
I think it's just related to the amount of soreness that I get in my traps.
Well, thank you for opening up about that a lot. I know that that's a bit of a journey. That's much is true. So
The brain is as much a muscle as the body.
You should be very true. Look at you with your
I'm
neuroplasticity
wisdom.
knowledge. Yeah. Yes, you are, Paige. Oh my goodness, I love my Paige.
I have good one-liners, what can I say?
All right. finish off here with a little bit of something called MRT, or myofascial release technique. Okay, so what that is I'm going to get you to look up and to the left for me.
Yeah.
Okay? I'm going to take a pointy elbow. I'm going to put it right there on the knot that you have yet to name. And I'm going to, actually I got you facing the wrong way. You're going to look up and to the right.
Yeah.
And then I'm going to take that elbow, put it right there, and now you're going to slowly look down and to the left. Okay, go ahead.
Oh yeah, I've done this kind of thing before, just not knowing
It's
what the
never
name
names.
of it is.
Okay, so I'm just trying to get your hair out of there because I don't want to.
All good.
That's not good pain. That's bad pain. So you should look up and to the right for me, and slowly down to the left. Go ahead.
Oh yeah, I remember this stupid shit.
She remembers it fondly, apparently.
Jason Kobrick, if you're listening to this, I hate you.
Up and to the right. Making the call outs. I'll tag him below. And good. If I'm going too hard,
No, you're good.
I was going to say if I'm going too hard, deal with it. up and to the right, down to the left. Something tells me that you got a sense of humor. So.
Pain makes pain go away? Is that how it works?
I believe that's what they taught at Chiro school, yeah. Up and to the right, down to the left. And once more, up and to the right, down to the left. Good. Awesome. Okay. So that's the left scap. We're going to face forward.
Yep.
Now we're going to tilt right ear to right shoulder. I'm going to come in there. Yep, no, come on. And
Okay.
then slowly tilt left ear to left shoulder, okay? This is for the traps. Those tight traps that you were talking about when you first came in.
Mm-hmm.
Right to right, left to left. Nice facial expressions, by the way. I think I just got a thumbnail. That's good.
You're welcome.
I appreciate you.
I'm all about giving content.
Right to the right, and left to the left.
I'd hate for people to think this is comfortable.
Oh, it's not. This sucks. This does not feel good. Right to the right, and left to left. I think I've said this a lot when I started, but I don't think I've said it lately, but like, the stuff that we do in here doesn't feel good. Okay, tilt right to right. But I feel like I became a much more efficient practitioner when I stopped worrying about it feel good, right? And for whatever reason, when I stopped caring about hurting, okay, within reason, of course, the patient in the clinic, you know, they started getting a lot better, and they started improving a lot on their presenting conditions. Now we're going to do the same on the other side for
Gotcha.
symmetry's sake, okay? You can
So-
usually look up and to the left, good. Hands now down and to right, slowly. Good, up and to left. Down and to right. To that end, if anybody watching this feels the need to be therapeutically beat up,
Book this.
You know who to call, right? Up and to left. Down and to right. Up and to left, down and to right. And up to the left, down to the right. One more time on that, okay? Up to left, down to right. Nice. Okay, face forward. Left ear to left shoulder, and now right to right. I'm gonna get that hair out of there, good. And left to left, right to right. Left to left, right to right. And left to left, right to right. Ooh.
Do I have an unnamed knot on that side too?
You got twins. Congratulations. Yeah.
I expect baby shower gifts.
Unfortunately, my bank expects credit payments, so they take priority.
That's fair.
I know they say patients first, but that just ain't true when you're with CIBC. So I'll get you to shrug your shoulders up for me, please, and slowly lower down. Give it an up, slowly lower down, and up, slowly lower down. Phenomenal. Paige, how did you find all of that?
Oh, very good.
Good. Okay.
I'm very used to this kind of stuff
Yeah.
and very used to what I'm getting.
You're-
Or very close.
That's okay. Words are
I
hard.
can't speak.
Do you feel kind of relaxed
Yes.
after that? That's
yes.
why.
I honestly, there's just like the looseness of my traps just goes up to into my brain,
Oh,
and
I
I just
understand.
can't do anything.
It's Jello brain now.
Oh, yeah.
That's a very common thing here after people are done once again, therapeutically being beaten up, they feel loose, also just mentally very relaxed, very calm, so not unheard of. Yeah. Any questions, comments, concerns, anything that you liked about it the most, or?
I mean, I love a good neck crack, so
Okay,
that was
good.
really,
I'm
really
happy
nice.
we were able to get those in for you then. Yeah.
And then, as much as I hated whatever the MRT acronym was at the end, it feels really good now.
That's just the truth. That's another one. People are like, I hate it, but it's the after effects, right?
It's what's causing the jello brain, and it's great.
All right, so it looks like you're flying out Saturday evening, okay? I think we probably need to see at least one more time between now and then to kick the traps once more, or elbow the traps once more.
Yep.
But otherwise, like, I'm confident we're going to have you feeling better. All right?
Perfect.
So thanks for coming in today. Thanks for letting us do this video. Really appreciate it. You take care, Paige.
Yep. Don't forget to like, comment, and subscribe.
Thank you, Paige.